Hello, my name is Barbra Bohannan, and I am the coordinator for policy and research at the Swedish Psoriasis Association. And I have lived with psoriasis since I was 5 years old, and with psoriatic arthritis since I was in my early teens. Recently, I was invited to the EULAR Congress to discuss how both physicians and patient leaders can help change the story for people living with inflammatory joint disease, to ensure that they can truly get the best opportunities to live, love, and work in spite of their condition. So today I would like to share with you 2 tips for my presentation. One being the ability to identify and adapt, and the other would be how to approach difficult subjects. So for the first one, identify and adapt. That pertains to the fact that the burden of disease may vary greatly over time when you live with an inflammatory chronic condition, such as I do. Looking back over my life, my needs at 5 or 15 or at 35 as a new mother, or today at 48 varies greatly. Both the burden of disease and the challenges that I have had to face have not been the same throughout my life, not even from year to year. And you have to keep in mind that these challenges can be quite time-consuming and difficult for the person in front of you to deal with. And they can vary a lot as well. When you're young, it would be school, later on work. You also have hormonal factors such as puberty, pregnancy, comorbidities, of course, and also stress and other environmental factors. These are all factors that you have to identify when speaking with the person in front of you that you are trying to treat. Another aspect, of course, of treating someone efficiently and effectively is that you have to realize that the risk aversion to treatment may also vary. Age, gender, and disease severity factor in here as well. There are also studies that suggest that the impact of disease may differ between men and women, both in psoriasis and psoriatic arthritis. So what would be the key takeaway here? Well, you need to treat the person when and where they are at, right here and right now, not where they were 10 years ago or 5 years ago, or even just a few months ago. You need to really talk to this individual, identify the burden of disease, the challenge that they are facing, and what they need dealt with here and now to make sure that you change their life story for the better. And if you really want to help this person where and when they are at right now, you need to include all aspects pertaining to quality of life. And that includes topics that might be difficult to approach, such as mental health, sexual health, reproductive health. We know that mental health and sexual health are impaired when it comes to persons living with psoriatic disease. So they do need to be addressed in order for you as a physician to be able to individualize the treatment plan for maximum effect and impact. So how? Well, one true and trusted format is to not start by asking, actually, but rather informing. So if you share with your patients that this might be something that many people living with psoriatic disease find difficult, that is a specific burden on their life or a challenge, then you lay the groundwork for starting a discussion. After informing, you can ask, is this something that you have a challenge with in your life? And maybe you won't get an answer that day, but you will open up for a conversation later on. Of course, you also have to listen to what this person will tell you when you ask, and then you need to act upon it. So, kind of a recap here then. What do I need to know and understand to help this person? What do I need to know and understand about their challenges, their burden of disease right here and right now? And also, what does this person need to understand in order to be helped? Understanding goes both ways, but you won't come close to understanding each other if you are unwilling to ask even the more difficult and sensitive of questions and then listening to the answer. See the person sitting there in front of you in your office as a part of the solution, not a problem. Together, you can change the story for the better. Thank you for listening.